Welcome back to Canadian Justice, where we are discussing the potential expansion of medical assistance in dying, also known as MAID, to people who are suffering solely from psychiatric conditions or mental illness. Now, Dr. Gain, you are a psychiatrist. You've expressed some concerns about the expansion of MAID for mental illness. You outlined two of the policy concerns. What was the third?
So the third relates to the fact that especially the most marginalized Canadians suffering from poverty, loneliness, other social suffering would be at particular risk. We are already seeing that as MAID expands beyond end of life conditions, when people are seeking it for disabilities in their 20s, 30s, 40s, we're already seeing that some people are seeking it pushed through that door for life suffering, like poverty, like housing insecurity. And unfortunately, when mental illness is also involved, people with mental illness disproportionately suffer from social suffering like that. And so it risks those people seeking it for reasons I think most Canadians would think we should be helping them live better for, rather than providing easier and earlier death for.
Professor Lemmens, I think one of the things that's surprising to a lot of Canadians is that MAID hasn't expanded to include mental illness because there have been a lot of reports that in practice that is in fact already happening. Is that an accurate perception or what's going on here with the reports of people who are getting medical assistance and dying for example, economic reasons? Is this something that people we need to be concerned about is actually already happening, even though the government has not officially endorsed this expansion?
Yes, I think that is a concern. I think there were reasons to say that it would be particularly problematic to start expanding MAID for sole reasons of mental illness. But we do already have persons with disabilities who are who may have comorbidities, may also suffer from mental illness. And I think we're currently already failing in filtering out why people are asking for medical assistance and dying. And even before the law was changed in 2021, there had been reports of, for example, people being brought to an emergency room. I'm thinking here particularly of one case in BC of Alan Nichols, who was brought to an emergency room, was assessed as suicidal, and received MAID 4 weeks later without a clear diagnosis of terminal illness. And so there are concerns that we're not filtering out mental illness very well in our system, which is really very much geared towards promoting access to medical assistance in dying, and according to many, including myself, not sufficiently focusing on how to protect people against dying in a system that allows physicians to offer medical assistance in dying as a form of care.
Dr. Gained, how many people are actually receiving MAID in Canada right now? Do we have the numbers on that right now?
We have the numbers up until 2022. That's the last year we have national numbers for. And what I can let you know is that no country on the planet has seen the explosive growth in MAID that Canada has seen in the few short years since it came in. And by 2022, it saw another 30% increase from the previous year's numbers. And in 2022, over 13,000 Canadians died by MAID, and that represents over 4% of all Canadian deaths. For some provinces, it was up to 5.5% to 6.5%. And within that, there are troubling trends emerging where, for some reasons, we see a gender gap of more women than men getting MAID for some conditions. And over 1/3 of those 13,000 Canadians who got MAID cited feeling a burden as a source of suffering leading to their MAID request.
I mean, what guardrails are actually in place, Dr. Gain, to ensure that people, I mean, including, marginalized people or people who are economically vulnerable and sick, but with treatable conditions, that they're not pressured in some way to get MAID?
Well, this is precisely part of the problem that so many of us are worried about, that there are not actually, I mean, I can give you an example that when the expert panel tasked with looking at setting things up for implementing mental illness MAID,
Mhm.
they literally came back and said, we're not recommending any additional legislative safeguards, despite the fact that in Canada, you don't have to actually have had access to care or treatment before getting MAID. All you need to be told is of available options of care. And so those kinds of suggestions are not guardrails. They're not safeguards. When we're providing death like this, we need strong legislative safeguards. And, in
Mhm.
terms of guidelines or suggestions,
Let's get to that in the next segment. We've got to go to break.